All right, welcome to Little Steps, Big Gains. In this video, we are going to talk posture. We are going to start at the top of our head and work all the way down to the bottom of our feet. And we're going to talk about how posture affects each one of those areas, why it affects those areas, but even better, what we can do about it. I will give 2 to 3 exercises per area that you can find out what works for you. Research shows don't give too much because then it's just too much. And then if you're looking for something to mix it up, I do have a 30-day program for sitting and standing, but it also works on posture if you're interested in a little bit of diversity, or there's tons of posture programs out there. You find what works for you. So I hope you find something educational and even better applicable. Let's get going. Okay, let's start up at the neck and let's talk about this. Okay, so if your head is about 8 to 10 pounds and you're in a forward head posture, what does that do to your neck muscles? Yes, you're exactly right. It causes a lot of strain. In fact, my courses, a few of them have said that for every inch forward, you need to add up that weight to see that that's much more stress and strain on the neck muscles. We get weakness, lengthening in the back, and we get tightness in the front. And so now we're also limited in range of motion. And it's for that reason that there is a statistical evidence-based correlation between weakness of the neck muscles and neck pain. And we will talk about that as we go. Okay, now let's go to the front when we have that forward head posture. What happens to our swallowing? Yes, it's that much more difficult. Why? Well, they've had individuals, one study had them swallow about 25 milliliters of water in different positions. And they found that the easiest position for speed and comfort was an upright position. And not only that, but it helped individuals close the airways in correct timing in order to get that water down into the stomach and not fall into the lungs, which is called aspiration. So that was also essential for swallowing function. What about your voice and your volume? We will talk about that when we travel down into the lungs, but yes, it's that much harder also to project that volume for voice. And then this also just correlates overall with eye contact upright as well. Okay, so what can we do about that weakness of those neck muscles? I'm going to go through 2 of the most evidence-based exercises that we can do. And then I'm also going to say what let's not do, okay? Now, first off, I'm going to show you the most embarrassing exercise I could do on the internet, but this is not about me. This is about you. Okay, number 1, chin tucks. So we are going to take our chin and tuck it down and back and give yourself a good old double chin. So I'll put my finger here. This is our starting position, and this is what I do with my patients. Let's start with just keeping our finger here right where our chin is. Now I want you to take that chin and tuck it down and back. And I want to see a good space there where we start and end. So this is what we want. It's called a chin tuck. We're retracting the neck and the head, pulling the head back. What do we not want to do? Cervical extension, and this is one of the biggest mistakes I see people. I want to work on my neck muscle, so I'm going to go up and down and up and down, and I am getting so strong. And actually, it's the worst thing you can do because you're actually causing compression and stress on the cervical neck there. Another thing that I don't recommend is neck circles, because that's been shown to close up the arteries between to and from the brain and the heart. So believe it or not, neck circles are not very good either. Chin tucks are. So we can do a chin tuck laying down, sitting in a chair, or I even like standing because it prevents us from cheating when we have some stability of our body. So we're not kind of doing, look at me, I'm doing amazing, and we're actually moving our body and not our neck. So when we're at the wall, we want the back of the occiput. We want the back of the skull, the bottom part. We want that against the wall, not the top. So I have people at the wall, shoulder blades are back, and we're going to tuck that chin down and back. And even better, let's hold it there for 5 to 10 seconds. Give you some endurance muscle strengthening there. So it's like an isometric contraction. holding that down and back. So chin tucks against a wall are phenomenal as well. All right, that is our first exercise. Let's move to the next one. Okay, our second exercise is actually done in laying, and it's not just an exercise, but it's also a test. Okay, so I'm gonna lay down and I'm gonna give myself that flattering internet double chin, where I'm going to be lifting my head off the bed and trying to keep my chin tucked down, okay? It'd be great if I could get myself about an inch off the bed. We don't want cervical extension, right? That extension, that's just going to cause more compression on the cervical spine. All right, so this is our start. I'm going to tuck that chin, lift and hold that head up. That's good. This is bad. Okay, so believe it or not, that exercise is also a test. It's called the cervical cranial flexion test. And it assesses the strength and endurance of those deep neck flexor muscles. On average, it's been shown that men score about 38 seconds and women about 28 seconds, but those who had a correlation with neck pain were only at about 21 seconds. So there's that correlation there. Now, how do I make this an exercise? Well, first off, I need to assess, and we need to assess the strength in general. So we do that exercise in that test and we start that timer, and as soon as an individual starts to cheat or do things incorrectly, or that head is falling back or we're shaking, we need to stop right away. Then from there, that's our start. We can work our way up. But we don't want to say, all right, I'm going to start the timer for 30 seconds and you're going to hold for 30 seconds. They might only be able to do 10 seconds correctly. So we need to stop. That is where we start with that exercise. If your physical therapist has prescribed exercises, please follow theirs, okay? This is not meant to, substitute. This is meant to be supplemental and provide evidence-based exercises for you. All right, let's work our way down. We covered the neck. Now let's go to those scapulas. This is a model of a scapula. It's those wings and back. Now, when we get weak back there, we start to fall forward, and the muscles that stabilize the medial border of the scapula, the inside border to the spine, get weak, and this scapula falls forward and rotates down. Now, what happens to the humerus, your shoulder bone, when that happens? Okay, a lot of times it's going to internally rotate. And can you see what happens between the space that hits up on it's called your acromion, and your humeral head? So it's going to tilt down, and the humeral head is often going to rotate in. And see what happens there? The space between those two decreases. Here's on me. Ready? Right? Do you see the way I tilt forward and my humeral head often rotates in? That's when we can get limited range of motion, as well as possible nerve impingement, a stress on the rotator cuff muscles. So those scapulas and back actually affect our entire limb. When we reach up, approximately we need, for every 2 degrees of motion of this shoulder, we need about 1 degree of the scapula. They have to work together. Neither of them works independently of the other. So we absolutely need those scapular stabilizers. That's what they call it. We need them strong to pull that scapula back into place to help us with our posture, but also the proper alignment of our humeral head, that shoulder. Okay, what can we do for those scapulas in sitting and standing? Here are a few of my go-tos. First off, most definitely practice bringing those scapulas down and back. Phenomenal. But now I want you to take your arms at your side, and I want you to open up and rotate out while you do it. Do you feel the difference? Absolutely, because remember that shoulder and scapula absolutely move together. Wonderful. Now we can make our way up. We can make a W, also very good. Tuck those scapulas down and back. Now, what about a robber? Now, this is where we're up like this, and I even like goalposts. So goalposts is where I'm going to flip my hands and take my thumbs to the back of the room, because that gives us a little bit more of a target. Wonderful. In that kind of motion, I love Jack in the Box. So I'm going to cross my hands and I'm going to protract my scapulas down, and then I'm going to open up. Good old Jack in the Box. That's very similar to that goalpost by adding a little bit of protraction first. Now you can also take it to the next level by a good old band, opening up and adding that resistance. Phenomenal. Really great go-to exercises in sitting. Now let's go to standing. Standing at the wall, one of my go-tos is hand presses. So I'm going to take my hands and I'm going to press them back into the wall into a good isometric, holding for about 10 seconds. Try it, you'll feel it. Now I'm going to flip my hands and I'm going to do an angel where I'm going to go, oh my goodness, all the way up. And now you're getting some good old range of motion. Now, if you need a starting point, this is a great start. And if you're really weak or tight, you're probably going to be about here. Slowly work your way back to get the back of your hands to the wall. You will feel that. And now remember, we're stretching out the front and strengthening the back at the same time. Absolutely phenomenal. So those are a few of my go-tos in standing. Okay. So in this position, I have my pillow in a vertical position, which is ideal, but a horizontal position will do too. Okay, so I'm going to have my hands behind my head and I'm going to push my elbows down and back into the bed and open up my chest, which is going to stretch out those pecs and strengthen those back scapulas and hold, if I can, anywhere between 15 to 30 seconds. Phenomenal exercise right there. Okay, so we talked about the back, the scapulas, but remember, it's not just them being weak, it's also the front, the pecs that attach from our sternum to the shoulders that are tight. And if they pull us forward, they're going to pull those scapulas forward down and rotate our humeral head, right? Rotate them in. So we absolutely need to stretch out the front. Now, the good news is a lot of those back strengthening exercises do that, right? Just like we were stretching out here, making our angels. Those elbow presses in bed, absolutely great for that. Now, another thing I can do is I can put my hands at the wall, and I'll show this to you, and I can turn my body away from it, and you'll feel a stretch, and then you can crawl up the wall, and you'll really feel it. So let me show you. You'll absolutely feel that. Another popular one is door stretches or corner stretches, I should say, where you have both hands in a corner and you step forward, down and back. My courses, they said to just be cautious about that if you have any anterior instability of the humeral head, any pathologies there, because you don't want to cause too much strain at the anterior capsule of the humerus, but you do want to stretch out those pecs. So, just be careful with that one. Okay, let's keep going. We're making our way from our head to our feet, the bottom of the feet. So now this is in conjunction with the chest, but we're kind of creeping down to those lungs. And when we fall forward a lot, we get this muscle stiffness from being in the same position for so long. If you have a disease called Parkinson's, that affects the automatic activities. So your brain's often not giving the feedback to stand up tall, those reminders. We all need those reminders though. And a lot of times, especially if we're doing two things at once, it requires concentration to be up tall. So we've got that as well going on. But let's keep going down. And now we're going to talk about how when we are in this kind of forward position, that actually really affects our swallowing, because we're talking about the lungs, but the lungs, we absolutely need the coordination between the inhale and exhale with our swallow. I am not a know-it-all. I have a specialist that I'm going to interview on this. Okay, so we're making our way down and we'll talk about the lungs. We absolutely need that breath support. If we have tightness in the muscles that connect each rib called the intercostals, we don't get that lung expansion. Also, we need this muscle called the diaphragm, which is our largest breathing muscle, to completely lower. It sits under the lungs and heart. When we inhale, it lowers. And when we exhale, it recoils, and we absolutely need it to make that full range of motion. They've shown that if you have diaphragm tightening there, if your diaphragm is a little bit flatter because it's not recoiling, that is correlated with back pain also. Okay, so we absolutely need that diaphragm long. We absolutely need those intercostals stretched out, that diaphragm stretched out. That's where posture exercises come in. So when you work on all these posture exercises, it's not just for the way you look, but it's also for your breath support. Now talk to your doctor, but respiratory muscle strength training is usually phenomenal for everyone. Talk to your physician, but there are tons of devices out there that you can Google, or maybe you already have one. Use what you have or Google your own, but this happens to be one that I like. This is not a paid promotion. This is me being an OT that wants to share. This happens to be my favorite. It's called the Breather. And I like this because it has dials for inhale and exhale for that resistance, but it also has handy dandy instructions and videos. So that way you're doing it correctly. This happens to be my favorite. No paid promotions there, but we absolutely need to strengthen that diaphragm as well as stretch it out in all positions, okay? Those posture exercises, those stretches will help with that. My videos for my exercise programs, I try to target that as well. So most definitely, what else can you do for your voicing? There are things, if you Google, called voice aerobics. That's really cool. Singing, boxing, just the LSVT with the loud. Those are all phenomenal resources that I would check out if I were you. Okay, let's keep going. We're making our way down. All right, we talked about the front. Now let's talk about the back, because we absolutely need what's called back extensors to pull us upright. Our spine has these curves along it. Those are needed for shock absorption. And as amazing as it is, if we stretch the pecs, strengthen the scapulas, and here we are, we're still falling over, those back extensors need to kick in, okay? Now, for a muscle to be efficient, it has to be at a proper length. What's happening to my back extensors along my low back if I'm falling over? Yes, they are lengthened, which makes them weak. And now it requires so much energy. It's so energy demanding to stand up straight. So we absolutely need to strengthen those 100%. So let me show you a few of my go-tos. Okay, so for those back extensors, we can do an isometric elbow dig in the chair or an isometric back extension in a chair. So I'm going to turn sideways. And you can take your elbows and dig them into a chair for a good 5 to 10 seconds. Or an isometric back extension, pushing yourself into the chair. Now, please be cautious if you have any kind of skin breakdown on the coccyx, sacrum, or your back. Please be very cautious about that. But those are 2 exercises I have learned. Now, let's go to the bed. All right, elbow digs. Dig those elbows down and back. Heel digs. Dig those heels down. Not if you have pressure sores though. Left heel, right elbow. Right elbow, left heel. Hold about 15 to 30 seconds. Perform 10 times. All right, let's talk glutes. Glutes is the nickname for the 3 butt muscles, maximus, medius, and minimus. And they are so necessary for upright posture, pelvic stabilization, especially during gait, and stair management. And that is why your physical therapist is so wise to target those muscles. Please follow their protocol above mine if you have a physical therapist that's targeting those. Okay, please do that. But anyways, they're absolutely necessary for pulling us upright. There's also tests that show that glute medius endurance tests, if weak, correlate with back pain, which is something you should talk to your physician about separate than this, but just an FYI. Now, when that glute medius is weak, a lot of times when we walk, because it doesn't stabilize the pelvis will drop. That's called a Trendelenburg. And what physical therapists do is focus on strengthening that glute med to stabilize the pelvis. Because if your pelvis is dropping, your low back is side bending. Not only that, it will affect your entire limb, including your heel strike, your stride length. So it's absolutely necessary to stabilize that pelvis. Now, there are a few go-tos that I've learned, especially from physical therapists, but what they often do for exercises is they assess what's called the MVIC, maximum voluntary isometric contraction, to know, is this exercise efficient in recruiting those muscles? And here is a few go-tos that have very high MVICs. First off, so easy, gluteal squeezes, 81% recruitment there. And guess what that is? squeezing the butt and squeezing and holding, that has been shown to be very effective. So I would definitely do that. You can do that in laying, sitting, or standing, and it's very safe. So definitely start to include those butt squeezes. Now, a second one I've learned and I've seen to be very effective via research is actually hip abduction. And we'll do this in standing and sitting. Now, here's a reason why a lot of physical therapists I've seen are hesitant on this is because people do it incorrectly. And so if you're standing at the side of its surface, you really want to focus on bringing your leg out. And what happens, let me scoot back a little bit. What happens is people rotate that toe out because the glutes are so weak, and so they compensate, okay? When they externally rotate, what happens to that MVIC? It drops from about 81% to 33% because you are cheating, okay? So if you try this exercise, especially if a physical therapist has prescribed it, really focus on keeping that toe forward and then not side bending while you do it. We are cheating so much on this one. That's why we have to be careful, okay? But that has a high MVIC as well. Now we can do this in laying, and I'm going to show you how. Okay, they insist in being here. So what we can do in laying is hip abduction in laying. And this little guy really wants to be here, but we can lift our leg up and down. And what we don't want is to rotate that toe up, because remember, now we're not recruiting those glutes anymore or to the same degree, and we're cheating. So laying down, nice and easy, up and down. And when you do it correctly, you will feel it. All right, now we're making our way down to the ankles. And you're saying, why am I working on my ankles for posture? Well, a lot of times when I encourage my patients to stand upright, if the ankles aren't stable or strong, they keep going. And so to prevent that, they tend to leave their weight more on their toes. And that's really going to affect a lot of things. That low back, those glutes, everything's turning off, our balance, and then even walking our stride length, because our weight is forward instead of upright. So important. So we really need to strengthen those ankles. And when we lose our balance, that's called an ankle strategy. So we want to strengthen that ankle strategy. So there's a few ways we can do this that hopefully is safe. Put your safety first and foremost. But if you have a wall behind you and something stable in front of you, this is not a stable chair, but this is just an example. And if I just slowly sway back towards the wall, using my ankles to keep myself upright, and sway forward towards my stable surface, and just swaying back and forth, practicing an ankle strategy, improving what they call a sway envelope. I've seen physical therapists do little like ice cream cones, circles, to really strengthen the stability of those ankles. That is another option. Okay, we're going to end today at the bottom of our feet. We have made our way down. Now at the bottom of our feet, we have what's called plantar receptors, and they are responsible for giving our brain feedback about body contact, touch, and vibration. In fact, 80% of them are dedicated to vibration, which kicks in for gait training and balance, especially walking on uneven surfaces. Now, plantar receptor density peaks around the age of 40, to the point that by the time you're at the age of 70, you need twice the amount of stimulation to get the same input and response. And this really affects what we call distal lower extremity down there, proprioception, our ability to know where we are in space. So, what can we do about it? And there's a few things. First off, short foot exercises have been found to be very effective. We're pulling our toes in and making that foot short again. Now, this can be more fun with a task like putting Kleenexes on the ground and picking them up and either moving them over or even just picking them up and down. You can put a washcloth or a towel under your foot and squeeze it up and then relax it down. That's another option. Or little things like ping pong balls back and forth, tennis balls. There are some options to make your short foot exercise that much more fun. Now, another thing that's been very popular, very beneficial, is proprioceptive input via being mindful of it. Tai-Chi has been shown to be effective for this because it's slow and mindful, where we're paying attention to the bottom of our feet and the proprioceptive changes that happen there. So that's very effective as well. Barefoot training as well, but we have to be careful because studies show that there's an increased risk for falls with barefoot walking around the house. We have to be very cautious about that. But if you do things like your wall falls, back and forth for those ankles, pay attention to the bottom of your feet. Pay attention to the weight shift and increase that awareness and that proprioceptive input. All right, you are amazing for sticking through this, where we started at the top of our head and worked our way down to the bottom of our feet, talking about how posture affects each area and what we can do about it. Now, as a reminder, none of these exercises are meant to replace any personal advice, treatment, or exercises you have received from your physical, occupational, or speech therapist. None of this is also meant to replace any personal advice or instruction by your medical provider. If you've had a recent surgery or procedure, please consult with them to make sure these exercises are safe and appropriate for you. Also, I'd love it if you would check out my exercise programs that I made. I thought about a video a day is like medicine. Check those out. I included the link below. But thank you overall for coming. Please subscribe, and even better than that, please share, because that is what this vision is about, sharing resources. Because together, little steps every day, we can make some big gains.